everyone, this is Emma. It is the evening of Friday, March 6th. It's a bit later than I wanted to record this video and talk to you about the latest headlines with the coronavirus. You can kind of tell probably I'm in a dark bedroom, but I tried to turn on all the lights, so hopefully you can see me okay. First thing I want to do is jump in and look at the latest maps. So let me show that to you. This is that Johns Hopkins map up here in the upper left-hand corner. You can see that we are at over 102,000 cases throughout the world, and we are quickly approaching 3,500 deaths, and there are 57,000 recovered people so far. This map and others can only be as accurate as the data is that is getting put into them. If some countries are not reporting their true picture of what's going on, then the map is not going to be accurate. If some countries are not testing accurately or well enough, like is happening in the United States, then these numbers are going to reflect that. It's something to keep an eye on, and especially if you do live in the United States and you want to see how things are developing near you, it's up to you how much you want to trust this data, but I'm definitely seeing new dots pop up in places that weren't before. You can see there's 4 over here in Colorado. Seattle continues to grow. The numbers here, if you do use this map, they typically update pretty well, but it's not quite in real time. Sometimes I find things on the map that I expect to be updated more quickly. Sometimes it takes more than a day to get updated. I don't know exactly how often it gets updated or who does the updating, but you can look down here in the lower left-hand corner of the map and it'll tell you the last time that it was updated. And now I want to take you right over to today's article over on The Mind Unleashed. If you've watched the last couple of videos, or if you've looked at this article or the 2 articles before it, then you know that what we are doing is looking through all of the headlines coming out about the coronavirus and about the coronavirus disease, and we're picking out some of the most important things and we are sticking them in this article so that you don't have to go through all of the news and find out what you need to be paying attention to. We're trying to do that for you because this can be overwhelming and it's kind of a constant flow of news and headlines right now, and that is very hard to manage when you don't have a lot of time to do so. But like I said, this article is from earlier today. If you look up here, it was published at 3 p.m. Right now it's 10 p.m. In 7 hours, a lot of stuff can change with this virus. A lot of stuff has changed. So as I'm going through this with you, I do have a couple of smaller things that I want to add. But again, generally these articles summarize the news from the past 24 hours, so if we have another article out tomorrow or on Sunday, it'll catch up with some of the things that are missing from this now. As you've probably been aware of, the US is botching COVID-19 testing. For example, the CDC is reportedly refusing to test a nurse who has symptoms after she volunteered to assist with COVID-19 patients at a California hospital. According to a letter that was posted on Twitter, the CDC claims that she cannot be tested because she was properly protected during her time volunteering with the infected patients. We've embedded the tweet here. You can click on this letter if you want to see it for yourself. 22 million Californians are now eligible for free medically necessary COVID testing. Keywords there are medically necessary. The above example indicates how there still appears to be a discrepancy when it comes to deciding which situations warrant medically necessary testing and which ones don't. A thread posted to Twitter on Thursday by a man claiming his uncle had tested positive for COVID-19 in California says that his case is being mismanaged. Scott Bell said that his uncle, who lives in Venice, California, was skiing in the Italian Alps with 6 other guys. 4 of them, including his uncle, now have the coronavirus. Scott Bell tweeted that his aunt, who has been caring for his uncle, had been moving throughout the community before she was eventually quarantined. And you can see that story in his tweets here. There seems to be a lot of similar stories to that floating around the internet more, where people are saying, I wanted to get a test, I was potentially in contact with somebody, I am helping somebody who has a confirmed case, and they don't want to test me, or they're not telling me to quarantine. There's a big disconnect in what is being said and what is actually happening right now. On Thursday, U.S. Vice President Mike Pence acknowledged that there are not enough COVID-19 tests currently available to meet the demand for them as the outbreak spreads. Pence, who is in charge of national coronavirus response, previously said that every American can be tested. Pence was quoted as saying, "We don't have enough tests today to meet what we anticipate will be the demand going forward." According to The Atlantic, only 1,895 Americans have been tested for the virus. and so far roughly 10% of those have tested positive. Again, this article was published earlier today, so those numbers have probably changed. Amid the shortages of tests, 6 U.S. states are not currently testing for COVID-19. These states include Alabama, Maine, Ohio, Oklahoma, West Virginia, and Wyoming, according to the CDC. The CDC did recently relax the requirements needed for people to qualify for testing, but obviously if these states are not testing people, the requirements don't matter. Researchers from the Australian National University have looked at 7 outbreak scenarios and how those various scenarios might affect the world's wealth. The researchers' best case scenario predicts a global GDP loss of $2.4 trillion and a death toll of 15 million. Now that is the best case scenario out of the 7 scenarios that they ran. The worst case scenario said that the global death toll could reach a staggering 68 million people. The Guardian has published before and after photos of typically busy locations throughout the world emptied of people due to the virus's spread. Bethlehem's city streets appeared empty on Friday, with the exception of masked Palestinian police patrolling the area. On Thursday, Palestinian President Mahmoud Abbas declared a 30-day state of emergency after cases were reported in Bethlehem. Since this article was published, Colombia also confirmed their first cases of coronavirus. While some cities and countries have put a moratorium on large public gatherings with or without a declared state of emergency, others are operating as normal. Unfortunately, in those areas, some people are providing perfect examples as to why some feel moratoriums are the safest route. For example, it was revealed on Friday that a New Zealand man who had been later confirmed to be infected with the virus attended a crowded Tool concert in Auckland on February 28th. The man, who was in his 30s, attended the concert only days after returning from northern Italy with his partner, who also now has COVID-19. On Thursday, in what had been the country's highest single-day increase, Italy reported 41 new deaths, bringing the country's total to 148. The total dead has since increased to 197. Italy has the second highest death rate behind that of China. The first COVID-19 death has been reported in the UK as the number of cases doubled over a 48-hour period as Europe experiences a shortage in medicines and face masks due to disruptions in the supply chain caused by the novel coronavirus outbreak. Yahoo reports that many countries throughout the world rely on China for both drugs and drug ingredients. World health officials are warning countries to take the risk of COVID-19 more seriously. In addition to the health risk, CNA reports the epidemic has wreaked havoc on international business, tourism, sports events, and schools, with almost 300 million students sent home worldwide. Singapore minister and co-head of the country's virus task force says that the coronavirus is starting to look like a global pandemic. So a few of those things that were mentioned in that section are a good reminder for why it's important to pay attention to this and to start to prepare for it. Like I have mentioned before, even if you are not concerned about catching the virus yourself or concerned about if you do, you don't think it'll affect you badly, havoc has been wreaked on international business, tourism, sports events, schools, and more. This is something that will affect a lot of people even if you don't actually have the virus. We're already seeing shortages of things in stores. If you happen to live in a place that is quarantined for 2 weeks, is it going to be okay for you to have no income for 2 weeks? Things like that are questions that need to be asked, and people need to be planning just in case this does go down that route. Obviously, it has in China, and China is still under a massive quarantine. Cities in China, millions of people in China have been under quarantine for more than a month. I know a lot of people in the United States and probably a lot of people in other countries are not prepared for something like that to happen. Speaking of China, what's really happening in China? A Chinese official visiting Wuhan was heckled by local residents who yelled, "Fake, fake, everything is fake," as she inspected work related to quarantined residents. Chinese state media surprisingly reported rather than censored videos of this nature. Also in China, the Chinese outlet that had previously reported the story of a recovered COVID-19 patient who later died after testing negative for the virus and being discharged has removed that report. COVID-19 cases are exploding across the U.S. The U.S. state of Indiana has declared a public health emergency as the Indiana State Department of Health announced a patient who tested positive for COVID-19 in Marion County. According to reports, the person had recently traveled to Boston. Additional U.S. states, including Colorado, Maryland, and Nevada, have reported their first cases of the novel coronavirus as well. And since this was published, we also have our first case here in Minnesota. The third COVID-19 case has been confirmed in Arizona, which they are saying may signal community spread. 2 New Yorkers who attended the APAC conference in Washington, D.C. were just tested positive for COVID as well. U.S. President Donald Trump canceled his scheduled visit to the Centers for Disease Control and Prevention, Atlanta headquarters, according to a senior White House official. Houston has announced the city's 6th case. Mayor Sylvester Turner said there remains no evidence of community spread, no need to alter our normal activity in Houston, and certainly no reason to let fear grip our lives. The number of people quarantined in New York City continues to increase. According to the New York Times, the city's Department of Health is monitoring 2,773 people who are currently self-quarantining at home. Most of those being monitored had recently returned from China, Italy, Iran, South Korea, and Japan, according to a New York City health commissioner. The Daily Beast reports that New York City has 22 confirmed cases as of Thursday afternoon, as the city prepares for mayhem. New York City's mayor says we are going to see more cases like this as community transmission becomes more common. We want New Yorkers to be prepared and vigilant, not alarmed. We are taking the same decisive steps in every case to shut transmission down. Isolate and test each suspected case, trace close contacts, and isolate and test them as well. A local Seattle outlet has confirmed that the area's first quarantine village will utilize an Econo Lodge hotel in Kent, Washington. Seattle and King County will establish 3 quarantine villages total, but no public announcement has been made in the areas of those quarantine villages thus far. A local journalist said on Twitter, "I find this very interesting. Media is gathering for a tour arranged by King County at the Econo Lodge in Kent, the new location for a quarantine village for COVID-19 patients, but motel employees have no clue the motel's new purpose. The receptionist didn't know anything." Also in Washington, families of residents at the nursing home at the center of the Seattle area COVID-19 outbreak are speaking out. During a live press conference, families detailed their varied experiences in receiving contradictory information. Now we have that live, well, no longer live, we have that press conference embedded here that was live when it was recorded in front of the Life Care Center in Kirkland, Washington, that is just outside of Seattle. I highly recommend watching this. It's incredibly enlightening. It's very shocking. It's very disappointing to hear what these families have gone through and the contradictory information they've been given, but it's about 46 minutes long, so if you're going to watch that, just make sure you've got enough time. Some families have been told that, despite being quarantined with patients diagnosed with COVID-19, their loved ones would not be tested. Still another was told that their deceased relative died of natural causes and would not be tested for COVID-19 despite the outbreak. Pat Herrick, daughter of a deceased resident, said that she was told on Thursday morning that her mother had died and was later told that her mother was alive and doing well, before ultimately being told that her mother did in fact die. And this was the case where she was told that her mother died of natural causes and was showing no signs of the virus before her death, so they're not going to test. Over 20,000 people have signed an online petition demanding that Lake Washington School District cancel classes amid the outbreak in Washington state. The school district said in a statement, school closures can be disruptive and costly for families. The health officer for both Seattle and King County also allegedly said, "Do we really want to close the schools, or do we want to keep schools open so faculty can continue to come in and serve children?" However, a nearby school district did cancel all of their classes as of Thursday. You can see some pictures of the closed schools here along with a sign indicating that all after-school activities are canceled. This tweet here says that about 1 in 3 students were calling in sick anyways. So that probably played into their decision to close the entire district of 33 schools. Down here, we've got links to yesterday's update and yesterday's video, and a reminder to keep an eye out for our next article. And again, there's a link here to our Telegram feed of the latest news. Take a peek at that really quick and refresh it. If you want to follow this, if you use Telegram, if you don't use Telegram, you can just look at this feed in your browser that I'm showing you right here. Go to t.me/s/COVID-19 report. This is a great way to keep up with everything. I encourage you to have that open in a tab on your computer so you can just check it, because it's really important to keep up with this. So thank you for watching this 3rd video in our series of keeping you up to date on the latest headlines with the coronavirus. If it is not obvious to you yet, this is something that I urge you to pay attention to and to prepare for. Don't panic, but make sure that it doesn't catch you off guard if you do end up being in an area where supply chains are significantly interrupted, or you get swept up in a quarantine and you're unable to work. Be prepared with some food and extra medications and whatever it is you think you might need. I do not want to encourage anybody to panic, but I want to make sure that people are prepared and have a plan in place. Thanks again for watching, and look for our next update articles soon. Thanks.